Hello. Okay, so today we're going to talk a little bit about the lumbar traction. Obviously, before you do any type of traction inside a mechanical device, you have to do the manual first, just like how we did it for cervical. So we're going to go through our P's and C's with our patient. We're going to attempt manual lumbar traction in different positions depending on what feels best for your patient, and then addressing the levels of where it's going to be treating. And then once we figure that out, then we can go ahead and put our patient into the mechanical, give that a try and see if that's very effective for them. So hello, Miss Singh. My name is Jay-Z. I'm a PTA. I'm going to be working with you today. Is that okay? Your PT, Dr. Frank McCoy over here, stated that we're going to try some lumbar traction. I feel more comfortable doing a manual first, so that way I can kind of see the levels we're treating at. And then we're gonna try the home unit, so that way if it is effective and you feel like it's beneficial, we can see if the insurance will go ahead and cover it. Okay. Nice. So a couple of things. Are you pregnant? By any chance, are you on your menses for the month? No. Do you have any recent fractures or open wounds in that area? No. How's about any type of replacement? So any bars put in, any fusions, any pins? No. Okay. So we're gonna be treating that lower back lumbar region. Do you get dizzy at all? Do you get dizzy if you're lying down? No. Okay. So we're gonna have you lie down. What is it that we're treating you for today? Is it more of like muscle elongation? Do you feel pinching in your back? What do you feel?
Yeah, more like a pinching.
A pinch?
More of a lordosis, so it gets tight.
So make sure you're obviously reading the chart as well. Manual traction is really good for just decompression, right? That's what you're trying to do, is you're trying to take pressure either off the disc, off the joint, or muscle elongation, just to kind of feel a little bit more comfort. So we'll go ahead and do that. Do you feel more comfortable on your back, or how do you sleep at night?
On my side.
On your side? Okay, do you sleep on your side with your legs up a little bit, like in the fetal position, or do you sleep like a board?
Kind of up a little bit.
A little up a little bit? Okay. So that kind of gives me an idea of like, okay, she's going to be comfortable, possibly in the hook lying position. Again, if she has any respiratory issues, you need to be aware of that, because they can't lay flat on long periods of time as well. So do you have any respiratory issues? Do you sleep with a CPAP machine, or do you have any supplemental oxygen at the moment? No? Okay. So I am going to go ahead and wash my hands and be a good therapist and be clean. And I'm going to actually have this non-slippy pad. It's going to sit underneath your back, so that way when I start doing our test pulls for traction, we can see what feels the best for you without having you slide on the table, okay? So go ahead, you're gonna lie on your right shoulder, lie on your side, and then we're going to slowly go ahead and roll over onto your back. Beautiful. Did that hurt your back at all?
No.
No? Okay. So I'm going to go ahead and lift your bum-bums, and this is gonna go just a little bit above the sacrum, so that way it stays in place. There's various different ways of doing different types of pulls for manual traction. I'll show you guys a couple, and then you can figure out what's best for you. This is a mobilization belt, really good for traction. You can go ahead and purchase one on Amazon yourself, or if somebody works in inpatient, sometimes you can go ahead and get the straps, but they're like a seat belt. So it's going to sit, depending on what's wrong with the patient too. If they have knee issues, again, you have to ask all these things to see what's going to be good for them. So
I do have a partial tear in this ACL.
oh, you have a partial tear in the left ACL. Okay, so that limits me on doing another 10. So I'll show you, but I won't pull it, so that way you guys can see what it looks like. First, let's get the level of what we're treating at. If I did a straight pull, just like the cervical spine, straight pull is going to kind of be, instead of it going down the spine as the legs get, as the head gets higher, as the leg gets higher, it's actually going to go down the spine as well. No, why did I get that wrong? That's wrong. As the legs get higher, it goes up the spine. Excuse me. So, right? I think it sticks. This is a straight pull. That's gonna be L1, L2. Yeah. As the legs get higher, it goes down the spine as well. Okay. So, because it's flattening out the lordotic curvature in the back. So, if I'm doing a straight pull here, I'm going to go ahead and have the patient, if they want, they can go ahead and put their hands down to their side, have them breathe, they can hold so that way they don't feel like they're gonna go sliding down because of the friction. And we're just gonna pull at the ankles. Sometimes this is not comfortable for your patient because you're just kind of gripping at their ankles. So I use a belt, and I'll use the belt around my wrist and then around the patient. And you can go ahead and get a towel as well, and you can just pull this way as well. How does that feel?
I feel like you put that sticky thing there, so it's not really.
It's not really letting you pull? How much did I pull more?
There it goes.
There you go. So that would be for your L1, L2. And then that was one example, and that pull, we can go ahead and pull a little bit higher. So I'm stepping on a stool or working our way down. Still not comfortable right there at that pull?
It is. You're just strong and you're pulling me off the table.
And if 2 is too hard for you as well, then you can also just drop down and do 1 at a time. Okay? Depending on how big your patient is as well. So those are the middle pulls. So the first one, L1, L2, and then we go into L2, L3, 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 L4. If I wanted to get something higher to get her lordotic curvature flat, I'm gonna put a ball. Or if I wanted a bigger ball, I can also do that too. Same thing, I can go and wrap my hands around the feet. And again, because of that tear, I need to be a little bit more conscious of where and how much I'm pulling, because that's gonna pull at the knee joint, right? It's distracting at the ankles, distracting at the knee and the hip, which takes off on the lumbar. So that might not feel the greatest for the patient. So
That feels better on my spine than
that feels
I
good
like
on your
straight,
spine.
yeah.
Okay.
I feel more of a pull.
Then I'll do this one, and I really like this one. So I'm gonna put this ball underneath them as much as I can. I'm going to widen my strap as wide as it can go. And I'm going to take the knee out of the joint. Okay. And all I'm going to do is I'm going to sit back. So this is behind my tush, stabilizing here, and I'm just pulling off of their thighs. So that way it doesn't cause the separation at the knee. How does that feel? Not as much?
No, I feel like I'm arching my back.
Oh, okay. Let's go ahead and increase the ball size just a smidgen more. Well, and this is also another option too. You can have them in this position. And again, holding their feet so that way they don't move. Around the thighs, and I can pull there. Still not feeling as much there?
A little bit.
Not?
Yeah.
Okay, how's that on the knee?
Fine.
Let me get a bigger ball, just so I can get full flat on the lordosis. And lift up your legs. And so many different positions that you can try. It is to the patient's comfort, so I can figure out what's best, and then we'll go from there. All right, last one there, missing. Okay, and I'm going to just kind of pull. How does that feel?
That feels good.
Okay, so this one probably, is this the best out of all of them, or?
Yeah.
Okay. So I'm gonna just hold out here. Again, you can put a towel underneath your hands, or you can use your hands underneath the belt. And you're not gonna be able to do a static hold for 5 minutes like this before your hands start hurting like heck. So you're probably gonna release, take a break, resituate your hands, and then do that again. So because her back is flat, I'm gonna say this is more L5, S1. And we're pulling back. If your patient felt good pulls with a straight pull, I would also try them in the prone position and see if they feel that same relief. Because sometimes that also tells you, okay, they're a McKenzie protocol, meaning that they are an extension bias, and that you should probably do your mechanical setup as well in the prone position. So try to do at least 5 minutes of the manual, get them used to that comfort. Obviously in the real clinic, you're probably gonna supplement this with manual therapy for massage or soft tissue release, joint mobilizations, some gapping techniques. It just depends on what the PT has planned. So, Ms. Singh, we're gonna keep this ball and we're gonna try to move you to the mechanical. Take a second before we sit up. Any pain or in the knee or in the back at the moment? Okay. Alright, just like the same way we got up, we're gonna roll to the side. You're always guarding your patient. Always guarding your patient. I have a stool here so that way when she comes down, she's just gonna slowly scoot to the edge, give her a second before she goes, gather herself, and then she can go ahead and step down. Lovely, so now we have an idea of what level we're gonna treat at, and now we're gonna move to the mechanical. Alright, so mechanical is set up on the low mat. Again, this is the top of the mechanical lumbar traction. This is a home unit. They have bigger ones that you can set up different pulls and weight and poundage. We'll talk about that, but home unit, it has the thoracic strap here and then the lumbar strap here. With the piston, this is just like the cervical. You have pump, hold, and release. Turn it to the pump, and as you can see, it separates, and that's gonna be where your traction is gonna take place on your lumbar spine. And as you release, it comes back. So Ms. Singh, now we're gonna go ahead and put you in some straps. Your tush is gonna sit right here. This lower or top part is gonna be up at the hip bones or your iliac crest. Again, roll onto your side, roll on your back. Beautiful. And you just want to prevent further injury and happening for your patient. You tell them to just lie straight back, right? Abdominal use, there's pressure. If they have a disc issue, you're gonna just shift that right back up. All right, so palpate for the hip bones. Miss Singh, you're gonna head and scoot your booty down just a little bit more. Perfect. Now I'm gonna have my straps. You have a total of 4 straps. It gets to be a little bit of a mind game. I am going to go ahead and keep it kind of snug. The first one I'm always going to strap on is the pelvic strap, the top. And I'm gonna hold and pull, singe it until it's snatched, and then it's nice and tight, okay? Next, I'm gonna put the thoracic, since that's what's not gonna move, and I'm going to singe, tighten, release, and snatch. Right there. Alright. Too tight? Can you breathe? Little bit of a corset, okay? Sorry. If your patient has big bosoms too, it's gonna be uncomfortable. You can just make those straps a little bit looser. And then I'm gonna go back to my pelvis, get that last strap, make that nice and tight. And then this one I'm going to make somewhat tight, but a little bit more loose, so you're just not tightening it as taut. Okay, so that's your straps. You're going to ask a couple of personal questions. Either your patient can do the math or they can tell you. Miss Singh, for fun, can you go ahead and tell me what 1/3 of your weight is, please? 50? Okay. So you wanna, for their first pull, you always start at 1/3 their body weight. You don't wanna go too high or at half of their body weight because you don't know how much you're actually putting in pressure from the piston, and that can be excessive. So always start 1/3 of the body, or 1/4 of the body weight, excuse me. Let me double check here. 1/4 of the body weight for muscle and tissue elongation and acute conditions and a disc, and then no more than a 50 of the body weight for joint distractions and max separations. Okay, so I'm gonna go at 1/3 of her body weight. I'm going to go ahead and replace my ball here because that's what was comfortable for her when we did our manual traction. Okay, missing there is a little piston here. You got hold, pump, and release. I want you to go ahead and pump that to about 50 pounds of pressure, and if you feel like that's too much, we can always just release it and we can start there. Oh yeah, keep pumping. So that's 20. How's that feel? Okay. Gonna try go to 50. And again, it's a lordosis thing, so we can do it for muscle elongation where we would start at 1/4 of the body weight, or if I wanted to do more joint separation, I could go to 1/3 the body weight. You were at 22. And if they feel comfortable, then you can always have them just hold it there as well.
My top half is sliding.
Your top half's not moving, it's the bottom half. So again, if we did this for a disc issue, 5 to 8 minutes, no more than 8 minutes because that's the full refill of a disc. If we're doing it for muscle elongation, higher load, that's something that they're gonna feel. You can go ahead and pump, and then we'll do intermittent setting where it's going to be 3 on, 1 minute off, or 5 on and 1 minute off, depending how long you want them to go ahead and relax. And if you want to, muscle elongation can be a low load for a long static hold. Okay, how's that feel? That's up 40.
And I'm gonna try a little more because it was really kind of weird. That's good right about there.
Good, so then we'll stop at 42 for her. We'll go ahead and put it on for 5 minutes. So timer. And then Miss Singh, this is a bell. If for whatever reason I'm not here in the room and you feel like you need to get somebody, just ding that bell. It's gonna be put on hold, so that way the piston doesn't move and slowly start losing its air pressure. How does it feel under your knees? Good, good. Any dizziness, nausea? And as you can see, it's separated right here. Let me bring you guys a little closer. So you can see the separation right there. Okay, so we're gonna keep our patient on here for about 5 minutes. I'm going to dim some of the lights so she can relax. And then I'm gonna check in with the student. Yes, Miss Singh, did you have a question?
No, my head was in it.
I'll dim the light. Oh, they fixed the lights. There's no more Tourette's light. peace and quiet. We have about a minute and a half more. I'll let you go ahead and be peaceful. Missing. Feeling okay? So I'm gonna reset this to 1 minute. We're gonna go ahead and release the pump. And it's gonna release on its own speed. And it might not go all the way back to where it originally started, then that's fine. We're gonna go ahead and release for a minute, missing. And then if we wanted to do a full treatment, I'm gonna do this maybe 2 to 3 repetitions. She's in a quiet place. Don't leave your patient unattended. And then that would be basically in the treatment. Again, she's fully released. What I'm gonna go ahead and do is I'm going to release the straps, just in reverse order from what I attached it. So top strap first. So that way they can breathe. Then the bottom strap, then the top again, and then the belt. I'm going to move things out of the way, take her knees down. Just like she got in, she's gonna get the same way out. Go ahead and roll onto your right side, Miss Singh.
That's uncomfortable on your ribs a little bit, but doesn't hurt.
Okay. It's too tight, maybe.
No, when it pulls.
It's keeping you stable on top of there. So, good things to be aware of. And then you would have them go. The big things that you also want to make sure you're educating your patient after they do any type of real mechanical traction or home traction. They cannot stand up and bend over and touch their toes for the next 2 hours. Doing that is going to put in interabdominal, abdominal pressure, allows a disc to rupture or bit shifted out of place. So if they need to bend over or tie their shoes, have them sit, bring their leg up. Okay. Other than that, that's all I got. So you guys practice and have fun. Thank you.